Good morning, folks. Ron Ray here with Home Health Agency Growth. And I just wanted to pop in and give you a quick update on my business and what's been going on in the last few weeks. I haven't given you a proper update in a while. It was January 25th the last time I did that. That was when we actually submitted our state license application to the state of Texas. And if you've been following along, you saw a video where my application was actually late and stuck, and we had to intervene and get that moving along. But it was issued on March the 5th, and we went to work. So I brought my administrator in full-time, or at least more part-time, and got her to work, working on marketing and getting out there and trying to find some clients. So I just want to give you a little update on the money side also. On the last update, we were up to about $13,500. And since then, we've had some more expenses. So in between, I didn't spend a lot of money. I was paying the administrator and alternate administrator just for a few hours every other week. It wasn't much. It was like $100 every other week. It was not a lot of money. Just to keep them on the books. They weren't doing anything for that money. They were just sitting at home, just being on the books. Now, since we got our license and we're going to work, I brought in the administrator, still got the alternate, just sitting there, just kind of collecting a little bit of money just to keep her there if we need her in an alternate capacity, which we are going to need in a couple of weeks when my administrator goes on a pre-planned vacation. But that's okay. That's what she's there for. So we were up to $13,500 at that time. Since then, we've started spending some more money. So we've got some wages. We've got about $3,000 in wages since then. We had to buy some supplies. So, and supplies includes all the promotional items. So pens and notebooks and just little handout things that we're going to put in a box, that we got the boxes printed with our branding on it. And that's what we're going to take to potential referral partners like hospitals and nursing homes and assisted living facilities. All these people that we're going to try to get to come and send us business. We're putting together these packages, also include brochures, things that we send out. So far, we've got about $2,100 in that. Those things, they sound cheap when you see you can get a pen printed for 12 cents, but you have to buy 1,000 of them in order to get 12 cents. So you end up buying 500 and they cost you 80 cents. So don't be deceived by that. Do the math. Make sure you add it up. And I'll do another video later where we show all the items and how we're putting these boxes together, the packages that we're going to take out, and some other ideas that I have that I kind of want to run by you guys. And next, we did some advertising. So I sent out a bunch of emails. Emails are free. They don't cost anything as long as you have a list. So I am very, very fortunate. I have a list of about 2,600 people that are on my list for my insurance business. They're already my clients or they've met me in some capacity. And so we sent out that. That did get some responses. We didn't sign any business from that yet, but emails are ongoing. So you're always sending out emails. It doesn't cost you anything. So don't not do it. So we'll be sending out another email this week. It's been a little while. Now, we also sent out a printed letter. I have a couple of mail houses that I work with in my insurance business that do all my mail, all my direct mail. So we had them send out a letter that we put together, and that cost a bit of money, for a list that big. I think that ended up costing us about, it was close to $2,000. So we'll say $2,000. We bought the supplies. I would also include PPE, so gloves, masks, hand sanitizer. We had to buy the PPE kits, that the state requires you to have on hand. That's the full suit and everything that goes with that. And let's see, that's about insurance. So we bought our professional liability, our general liability, our workman's comp, and our cybersecurity insurance. So altogether, I'm paying monthly on that, but that's going to run me about $300 a month. So we've got the first payments made on that. It may be more when I actually add it all up and those bills start coming in. Okay, so what does that bring us to if we just total this up, so we're at about $21,000. At about $21,000 invested in this business before we've made one penny. Now, so that just goes to show you that this is a business that has a fairly high barrier to entry, meaning you can't be broke and expect to start a home health care business. It can be done because you can certainly go in and look at all the regs and do everything by yourself. But you've got to have some money. Your application fee costs money. That was almost $3,000 for that, just that I paid to the state. Then you've got to get insurance and supplies and people. So if you're doing this on your own, or if you're doing it at all, you need to make sure that you have some money set aside that you can live on while you're waiting to start making money, or you've got some income, you've got a job, or your spouse has a job, and you can support yourself while you're trying to get your business off the ground. So that's where we're at now. Since then, last week, actually, on April the 21st, we signed our first client. So we signed our first client at 12 hours a day times 7 days a week, which is, what is that? That's 84 hours a week. And we are charging $23 an hour for that care. That's $276 a day times 30 days. That's $8,280 a month. Now, out of that $8,280, I don't get to keep all that. I have to pay my caretakers. So we're paying them around, depending on their experience and what they've been doing, we're paying them around $13 to $14 an hour, but we're starting everybody out at $13 an hour. That's just a little bit more than the going rate in our area. The going rate is about $11 to $12 an hour. I'm paying a little bit more because I want good people that are going to stay with me. I don't want them to go flying off. Now, I'm not saying that paying $1 more is going to do that, but it sure is going to help. So now that doesn't mean that that's all it's costing me, because out of that has to come your share, your employer's share of Social Security and your employer's share of Medicare taxes. So it really costs more like $13.90, something like that. I have to do the math, but if you go in the Facebook group, Home Health Agency Growth Group on Facebook, I actually posted a spreadsheet that has all that data on it. So let's say that costs me, if I'm paying somebody $13 an hour and it costs me $13.95, so 95 cents in taxes per hour, times 12 times 30, it actually cost me, just in wages, $5,022 a month. So if we just do a quick little calculation here, oops. Sorry, I didn't mean to give you a class on how to calculate a spreadsheet. This is my profit, $32.58. My profit over my wage cost. That's it. That doesn't count all my other overhead. That doesn't count my office, my insurance, my software, my administrator that I have to pay, my advertising cost. So for this first client, I'm not really making a lot of money, and that's okay. It's the third, the fifth, the 10th client. That's where you start making money. So, but it does get some cash flow going, and I'm not going fully out of pocket. Now, the other thing I have to make sure I do is don't lose this client in the first week. So I have to make sure that I'm listening to the family, make sure that I'm taking good care of the patient, make sure that I'm taking good care of the family, and keep this client for as long as I can. And in the meantime, don't slow down. Just because you get one client doesn't mean you can let off the gas. You have to be out there going and getting more, because our goal is not to take care of one client at a time. Our goal is to take care of 100 clients at a time. So that's where we're at. We are rolling. We're working. So we're out there every day now. We're in Texas, and Texas has pretty low COVID rates. Our state, as far as the government is concerned, is open back up for business. No mask requirements, anything like that, as far as the state goes. So we are now looking to go out and start meeting people and marketing to people and getting referrals. I'm going to do another video on what our experience has been with Care.com. I've got some experience with that now, and I've got some thoughts for you, so keep an eye out for that, which brings me to the subscribe to the channel part. If you enjoyed the video, if you enjoyed the information in the video, if you find it helpful at all, please subscribe to the channel, click the little bell so that you get notified when I post those other 2 videos about our promotional items and my thoughts on Care.com. Also, give us a thumbs up, and that helps YouTube get this video out to other people who are searching for the same information. So I hope you have a great day, folks. I wish you the best of luck in your business. Give us some comments about what you think, any ideas that you have for me. Remember, I'm not an expert in this business. I'm just learning it just like you are. That's why I'm documenting it, though, so that we can grow together. Give me your ideas, your thoughts. If you think I could be doing something differently or better, or if you've got any questions, maybe I can pass on some of my experience to you. And then we'll see you on the next video, folks. Hope you have a great day. Bye.